towards me a little bit if you can, okay? All right, so we're gonna do the same thing that we did on that side on this side, but this time I'm gonna have you bend up your right and carry your right arm across. So this one here, I end up coming, bringing her a little more in line. And now I'm gonna have you rotate up again for me, just a little bit. Get this underneath. Right now, she's actually a little over, I can tell she's way over obliqued because if I actually put a little bit more. So right here, I see this a lot with students. They go like this. Does that really look like a 45-degree to y'all?
It kind of does, yeah.
But it's not.
Because it's halfway between
But-
the 40, the 90.
It doesn't.
But at the same time, hips and shoulders are not 100% aligned. So I can actually go here and feel she's slightly over oblique, slightly. So I'm gonna slide her back a little. This is gonna help me. I'm gonna bring your hips back a little bit too. Okay, there we go. Hips, shoulders. And that's the other thing you have to be mindful of. Because she has hips, the pelvis region is gonna look a little different than someone who has a little less hips, okay? So patients, and that's why I tell you to remember, hips and shoulder need to be, because I see this a lot, where they'll angle like this, and now this is more rotated than this, okay? So that's why you wanna make sure that she's where she needs to be, okay? But again, Mr. Gardner, he does the true 45 angle, he shoves it up. It doesn't, for me, it doesn't allow enough margin of error, so if you need to rotate back, then this does. You can still get a 45 degree, and I can still reach up under, and I'm in a beautiful, I can tell right now I'm in a beautiful, same thing like I did. You can actually feel it better on this side, so come feel from this side. See what I mean? Nice angled off the, everybody feel.
So we
You
just
can feel it, yeah, that angle that I'm talking about, you aces, love it. So, inferior rib margins right here, don't stop there. Need to go to 2 inches medial, my light field is just inside my aces, beautiful. If you want to leave your right marker on, it's fine. You just want to use one. If you want to mark your oblique, please do what your facilities ask, because some of them want you to mark the oblique. Just remember, whichever way the Scotty dog is looking, that's your oblique, okay? If you're only using one marker, okay? But this is her what side?
Her right side?
Okay. So, but, and if I do this, see how it angles here? It ends up angling down. The marker, you have to be careful when you place your markers on your patients because it looks down and you won't be able to see it all. If you want, we do not ding. If you want to mark your obliques, that's fine. Just make sure it's on the correct side of the patient. So this is her right side. If I wanted to just leave this here, I could. I could leave it just like this. Okay? Same thing, I can find her xiphoid, and I'm still xiphoid. I'm about 1/2 inch to 1 inch above it on the elevated side. And that's almost with every patient. You'll have your slender patients, because you brought up that point about slender patients, when you're obliquing them, your central ray ends up just barely on the elevated side.
Okay.
So it's maybe 1/4 of an inch, maybe. So, and then that's usually your really, really skinny patients. So, this is what we want here. Again, hips, shoulders, same plane, okay? Arm across their chest. You will have patients who say, hey, it's a little uncomfortable, can I do this? That's fine, but you have to be careful when they do that, that part of their body ends up rotating back too far, and then you're not as fully obliqued. So if they can just keep their arm right here to hold onto the table, let them hold onto the table, that's okay, okay? But again, marker on the correct side. Whether you mark your obliques or whatever, it's fine. But if you just want to use the one marker, it's okay. All right.